Welcome to the Cat Dad Show. My name is Scott Colby, and I'm going to share with you a clip of my interview with Dr. Lisa Fiorenza. She has her doctorate in veterinary medicine from Cornell University. And in this clip, I asked her what is feline infectious peritonitis, which is also known as FIP. How is it diagnosed? And I asked her also her approach to treating it. This is a clip of an interview I did with Dr. Lisa as part of my Feline Wellness Summit. If you would like to listen to the entire interview with Dr. Lisa, as well as interviews with 20 other feline wellness experts, just go to felinewellnesssummit.com and you can grab a free ticket. For now, enjoy this clip with Dr. Lisa.
Sure. So, feline infectious peritonitis, or FIP, it is caused by a coronavirus of cats, and it's exclusively cats. It's not contagious to people or dogs or really other pets. So it's just primarily a cat disease. And in the majority of cats, it really doesn't do much. It can be a little cold or a little stomach upset, and then they're totally fine. In a very small percentage, for a mixture of reasons. Some we don't necessarily know for sure, but we believe there's a genetic predisposition and usually some kind of stress trigger. But for whatever reasons, in that small percentage, it can transform into something very deadly, which is what we call FIP, or feline infectious peritonitis. It nowadays, because there are some similarities, I do kind of put it in the framework of COVID for people because it's similar in that the majority are fine and the small percentage get extremely sick. So I think that kind of helps people to put it into some kind of context, but always with the caveat that no, it's not the same. It's not contagious to people. You don't have to be afraid of your cat if it's diagnosed with FIP, just for that kind of frame of reference. It can be very difficult to diagnose. It's honestly a very hard diagnosis to make. I get a lot of people come in for second or third opinions, sometimes even more than that, because their vet isn't sure. They didn't know how to treat FIP. They weren't sure of the diagnosis. Their vet didn't know how to diagnose it, or they just, the pet owners found it on the internet and were worried that that could be what their cat was suffering from. Um, for most of my professional life, we have had no treatment for it. And when cats were diagnosed with FIP, they were told that they were going to die. It was a death sentence. Thankfully, in the past, it's about 6 years now, we've had research come out. I believe it was 2018, 2019 that we had some of the first papers come out to say that there were actually very good treatments that were curing these cats. Interestingly, one of the most popular treatments now, because it works very well, is something called GS. And it's just the molecule name, the chemical name of the drug. It's actually the sister drug to remdesivir that is used for treatment of COVID in humans. And we can actually use remdesivir. It's just there's better ways. The GS is actually better because it tends to be cheaper, it tends to be easier to access, and it can be given by mouth. But that was one of the first cures that we found for FIP, and it's still our best treatment in my opinion. It's been quite the story, quite the wild ride. Those papers came out, like I said, in 2018, 19, and I believe research started a couple years before that. It may have been 2016 or so, on GS and another compound called GC. Excuse me, but since then, until for the last few months, I've been saying this year now, it's actually last year, June of 2024 was the first time that American veterinarians were able to legally use this drug and legally save these cats. From about 2019 until that time, a gigantic black market started up across the world that basically got this drug into the hands of cat owners without going through any kind of veterinarian, any kind of legal uh, avenues. It was the only way that they could treat their cats and save their cats. Unfortunately, the drug companies that owned the patents on the molecules did not want to have it um, used. They didn't want to get it FDA approved for cats. So this was the only way that we could get that drug. And there was a network of veterinarians that rose up around that could not legally treat these pets or prescribe this drug, but were able to help a lot of the other people who were working through this network. And in 2020, I believe it was around March, April 2020, I started to work with these patients because one of my own patients, who I did not diagnose with FIP, but a specialist diagnosed with FIP, his mom came to me and said, I heard about this black market treatment for FIP coming from China. And what do you think? And I was like, well, I don't know. I don't know much about it. It's definitely sounds sketchy. Um, I don't really know if it's a good idea, but do we have any other choices? Not really.
Hmm.
So I started looking into it. And unfortunately, that patient did progress pretty rapidly and he passed away.
Great.
But he was my way into the community. And since then, I've been able to um, treat, I've lost count. It's got to be somewhere in the 50s or so, somewhere north of 50 cats with this disease. And I believe I've only lost about two in that
Wow.
50. So we've had an incredibly high success rate. We know that after the first week or two of treatment, the success rate is well over 90%. So these cats do wonderfully. And now that the drug is legally available, it's really just about getting the word out to the veterinarians who don't know yet to try to get treatment into the hands of more pet owners.
Yeah, amazing story there. And kudos to you for kind of doing your due diligence and getting involved in that community so you could treat these cats, quickly as possible. I know you said it can be difficult to diagnose. How would a pet owner, a cat owner, uh, know that there may be something wrong to this magnitude where their cat may have FIP?